When most of us think of healthcare, we picture doctors, nurses, and surgeons performing life-saving procedures. But behind every one of those moments is a system most people have never seen: medical coding. And though it may seem like a behind-the-scenes task, the truth is that accuracy in medical coding plays a crucial role in how well our healthcare system works. So what is medical coding? It's the process of translating every diagnosis, procedure, and medical service into standardized codes. These include systems like ICD-10 for diagnosis, CPT for procedures, and HCPCS for medications and equipment. These codes are used by insurance companies, researchers, hospitals, public health agencies. In other words, every time you go to that doctor, that visit turns into data, and that data starts with coding. You might be wondering why accuracy matters so much. Here's the reality. A single coding error can affect a patient's treatment. Imagine somebody with type 2 diabetes being mistakenly coded as type 1. That could lead to the wrong medication and serious complications. A 2021 study published by the Journal of the American Medical Association found that coding errors contributed to 7% of diagnostic mistakes in a major hospital system. That's not just a paperwork issue, that's a life or death issue. Accuracy also matters when it comes to billing. Insurance companies rely on codes to process claims. If a procedure is undercoded, the provider might not get fully reimbursed. And if a procedure is overcoded, it could trigger audits or legal actions. According to the American Medical Association, published in 2023, 1 in 5 medical claims are delayed or denied due to coding mistakes, costing the U.S. healthcare billions of dollars every year. When insurance won't cover a service because of a coding error, patients often end up stuck with unexpected bills. Beyond individual care and billing, inaccurate coding can have serious consequences for public health organizations. CDC and the World Health Organization use coded health data to track disease outbreaks and allocate resources. During the COVID-19 pandemic, accurate codes was essential for understanding how the virus was spreading and where help was not needed. If those codes are wrong, the data is wrong, and that leads to poor decision making. Finally, medical coding is also tied to legal compliance. Laws like HIPAA and the False Claim Act require accurate, honest documentation. Repeated or major errors can lead to audits, fines, or even loss of hospital accreditation. In conclusion, medical coding might happen behind the scenes, but its accuracy is absolutely critical on how it affects patient safety, fair billing, public health strategy, and legal accountability. Every code tells a story about a patient's condition and care. Making sure that story is accurate isn't just a technical task, it's a serious responsibility with real consequences. Thank you.